doctors now dismiss the clogged pipes model because it has been found that heart attacks generally occur in arteries that have minimal or moderate blockage. Findings suggest that plaques rich in cholesterol are more likely to rupture than the hard, calcified, dense plaques that narrow the artery channels.
Inflammation is what causes the plaque to form, to grow, and finally to burst. It's the true root of the problem. It goes without question that to live a long and healthy life, we need to reduce inflammation levels in our body now.
All right. Accepting that you believe that inflammation is the cause of heart disease, is there a valid biological reason for this?
The body knows that it's going to suffer injury, and it's built to repair that injury. The first response to injury is inflammation. Let's suppose you were stuck with a splinter. That splinter would bring foreign material and bacteria into the tissue. One of the first responses is the release of chemicals called cytokines that ask the white cells to come out of the blood vessels into the tissue to fight that battle.
Well, it's very interesting, but forgive me asking, what's it got to do with the arteries?
Well, excellent question, Derek. In the operating room, I often observed the classic signs of inflammation around a diseased artery. There was redness, there was swelling. It almost looked like a dirty 3-day-old scratch. That's when I delved into the research about the real cause of heart disease. You know, I started my career dedicated to curing heart disease. And although my surgical career was immensely satisfying with thousands of lives saved, I realized I was applying a mechanical solution to a biological problem and not really curing the disease at all. My research on inflammation and heart disease led me to help Inflorex to formulate the HeartShot.
HeartShot sounds great. How does it work?
It works throughout the entire body, interrupting the inflammatory pathway at several critical points.
Can't I just take a powerful anti-inflammatory drug?
You could, Derek, if you wanted to take the unnecessary risk. Every year, 16,000 people die from complications of anti-inflammatory drugs. The most recent example is Vioxx, which actually seems to cause heart attacks rather than prevent them. In the HeartShot formula, omega-3 fatty acids are the lead anti-inflammatory ingredient. Omega-3 helps you keep your triglycerides right where they should be. Furthermore, it promotes anti-inflammatory compounds and combats the pro-inflammatory effects of the overload of omega-6, which we have in the American diet.
You know, I think it's important to stress that omega-3 is anti-inflammatory, while omega-6 promotes inflammation. All right. Now, what makes the omega-3 essential fatty acids in your HeartShot formula different from all the other omega-3 products which you can buy in a store?
Well, first, it's been microencapsulated into a powder, which allows Inflorex chemists to mix it with the other essential anti-inflammatory ingredients, thereby multiplying the effects of omega-3. The HeartShot's powdered formula guarantees it's the purest concentrate with no mercury and no toxins from the fish source.
A powder, you say? Now, that is unique. What are the benefits of the powder over all the capsules we've been taking?
Well, first of all, it will replace about 14 pills that you might take now to get all the ingredients that are in the HeartShot. The microencapsulated formula allows better absorption into the bloodstream, and it's packaged in a convenient once-a-day dose.
And how do you take your powder HeartShot?
You can mix it with water, juice, or any of your favorite liquids.
Okay, besides omega-3, what other anti-inflammatory fire extinguishers are to be found in the formula for HeartShot?
The one I'm most excited about is conjugated linoleic acid, or simply CLA. Research studies have shown that CLA prevents and reduces, the amount of plaque in arteries. More good news. It's also been shown that CLA reduces abdominal fat. While CLA is helping to control inflammation, it also has been shown to reduce your appetite. You will not only be healthier, but you'll get rid of that pot belly.
I beg your pardon. That's quite a powerful collection of ingredients. Now, what else is in HeartShot?
Because we know that LDL, the so-called bad cholesterol, is not bad unless it becomes oxidized, we need antioxidants, and we've included them in the HeartShot. They help keep the artery lining smooth, and prevent LDL from being oxidized. Derek, there is a cure for heart disease. Medicine has been applying bandages for far too long. It's time we give people a chance to fight this disease head on.
Okay, I'm one of millions who typifies what I call the triple S syndrome. That's surgery, stents, and statins. Does that mean I'm cured? And can I now stop taking my medications if I take HeartShot?
No, Derek, that's between you and your doctor.
Well, we now know that heart disease starts in almost everyone during the teenage years. So by the time we get to my age, we could be in serious trouble. So will the HeartShot formula help at any stage in the progression of heart disease?
Yes, it will. Remember, inflammation is critical in every phase of heart disease. The beginning, the plaque formation, and finally the rupture. Therefore, whenever we stop the inflammation, we allow the body to do what it desperately wants to do: start healing.
Thank you, Doctor. This has been an eye-opening experience. I'm confident that millions of people, including myself, will live healthier lives because of your work.
Every time I hear Dr. Lindell speak, I'm moved to share that information with everyone I know and love. Well, let me share some very good news with you. Dr. Lindell, working with our scientists, have formulated a perfect blend of anti-inflammatory elements for our company. We have packaged this proprietary powder formula into a convenient packet we call HeartShot. HeartShot is an amazing formulation because it eliminates stacks of pills. One dosage of the powdered omega-3 would be the equivalent of taking 3 large omega-3 pills. It would take 3 pills containing CLA to be the equivalent of what is found in just 1 dosage of the HeartShot formula. This powerful formula eliminates more than 10 bottles of nutritional supplements, for within the formula you have CoQ10, vitamins B6 and 12, and selenium. No longer will you be taking these nutrients as individual supplements. If you're using any of these products, you should switch as soon as possible.
And remember, dead patients don't lie, so be sure to take your HeartShot.